everybody, and welcome to today's Instagram Live. We're really excited today. We're going to be having Dr. Lauren Neel from Nationwide Children's Hospital as our guest speaker today. She's a neonatologist, and we're really lucky to have the relationship that we have with Nationwide Children's Hospital, who is not only the lead site in our early detection network, but one of the lead hospitals in the country, particularly looking at infant developmental care and research in that area. So I am just now going to invite Mary Lauren to join us. And here we go. And I'm hoping that works, and welcome everybody. Hi.
Hi.
Thank you so much for joining us today.
Thanks for having me.
Of course. We're really excited. I'm really excited to sort of talk about this topic today because I think it's a big one for a lot of our parents out there. It's sort of life and transition after the NICU. And, you know, before we get started, do you just want to do a quick introduction of yourself and who you are and what you do?
Sure. Hey everybody, thanks for being here. I'm really honored to be with you guys. So as Rachel mentioned, I'm a neonatologist. I work in the NICU, and then I also follow these babies in our early development clinic. So I follow these kids until they're 3. And so I have a really fun opportunity to see them when they're tiny and very small, and then, you know, as they get bigger, and to get to work with their families longer. I also do research, and my research centers on basically how parents actually make a huge difference in terms of how our babies do. And and my goal is that I think NICU parents and babies are amazing, and I really want to help parents help their babies reach their amazing potential.
And I think, you know, when we're looking at our families who have come through the journey of being in the NICU, you know, everyone is so different. Some babies are, you know, now being born at such young ages, and we do know that they have high risk of developing things like cerebral palsy. But can you just sort of describe a little bit what your typical day would be like in the NICU?
Yeah, so, you know, I think typically the mornings start with rounds. So, you know, if a parent is there, you know, we would come by, the team would talk in a bunch of medical gibberish, and then ideally we would translate into, you know, English about what we're talking about the plan for the day, how the baby's doing, what are the baby's kind of next steps in terms of getting the baby home. Because the goal is to get the baby home with the family, because we know that's where they're going to do best. And then the rest of the day is mostly just caring for the baby. Usually the babies are on kind of an every 3-hour schedule, where every 3 hours they eat, they get their diaper changed, they get repositioned, those types of things. And then obviously just whatever comes up throughout the day, we deal with.
Because I think it sort of brings a good question sort of now going, all right, if a lot of people are used to that routine in the NICU, you know, you've just said there's usually sort of 3-hour rounds, and you know, there's all the different medical things that might be happening as well, which, you know, depending on each baby can be very complicated, you know, or at times, you know, if they are at that point in transitioning, it may just be that they're getting monitored to make sure that they are ready to go home. But what are some of the best ways for a family to sort of create a safe environment at home, and how to transition? Like, it's such a difficult time for a lot of families, but also exciting. They're finally getting to take their baby home after all these months.
Yes, I mean, I think that the transition to home is exactly what you said. You know, it's what we have all been wanting, and it's what the family more than anyone has been wanting for the baby's whole life. So it's a really exciting time, but it's also a very scary time. And I think acknowledging that this is a big transition, and it might feel scary and it might feel overwhelming. I think is really important, that's not an unusual feeling. That's how most of our families feel. But also, I just want to say, you can do it. you are the most important person in your baby's life. And yes, there's going to be a transition. And yes, there's probably going to be some rough days and rough moments, but your baby is better off at home with you. And I think trusting the process. So the NICU is not going to send home the baby until the baby's ready to go home. And I think, the baby has to meet certain criteria. They have to maintain their temperature. They have to not have spells for a certain number of days. They have to eat. They have to gain weight. They have to do all these things. And so I think really trusting the process and trusting that, your baby's ready to go home with you.
And we are getting some questions in. So I want to make sure that as we sort of go through this, that we are answering people's questions, because it is sort of, what are the top needs ways to help a family as they transition from the home? Because we do have obviously providers that are listening as well. What's sort of your top 5 that you would sort of think about when you're communicating that moment when someone's about to home?
Yeah, so I think the more, especially as the baby does get closer to home, I think the more the family is able to be there and do more and more of the cares and sort of take over more of the care of the baby, I think that gives people more confidence that they know how to do this.
Yep.
I think all of the trainings that the family gets, the discharge teaching, the car seat teaching, the CPR training, I think just all of those things kind of instill confidence that you're ready. I think identifying before you go home, kind of identifying, this may be hard, and who are my go-to people? How am I going to support myself, as we transition? Who am I going to call when I'm having a rough moment? These types of things. I think that's really important too.
I think that's great advice, like actually knowing, oh, right, who is my support network that you have met in the hospital? But otherwise, who is around you? Who's your family? Who's your friends? Maybe it's even a neighbor.
Yes.
We've just got another question that we do need to answer, because I want to make sure that everyone understands even what we're talking about. So what does neonatal mean? In England, we have the ICU, not a NICU. So can you just let's describe that so everyone knows who we're talking about?
Yes, thank you. I'm doing the medical thing where we, speak in language that makes no sense. So the neonatal ICU is a place for babies that need ICU level care. So typically, half our babies are usually are preterm, to varying degrees. And then half are full-term kids that have some issue as well. So it's basically a baby intensive care unit.
And they go straight to that intensive care unit from the delivery room, pretty much.
Correct.
Is that correct?
In most cases, yes.
Yeah. We've just got another question as well. So does being on a vent, because maybe let's talk about the NICU for a little bit longer before we go to home, because we've got so many wonderful things to talk about at home. But does being on a ventilator in the NICU lead to reduced lung capacity with CP concern? An adult can, I'm trying to just read, early adult with CP concerned about COVID-19. So I suppose obviously we're hearing a lot right now about people being on ventilators due to COVID-19. Obviously that is due to a virus, and that's why they're on those ventilators. Babies are on ventilators in the NICU, but that's for a different reason. It's not for a virus. Can you just sort of describe a little bit about what you see in that regards?
Sure. So, one of the biggest challenges we have when a baby is born early is that their lungs are very immature. Obviously, if you're born very, very early, your lungs are very, very immature. If you're born a little bit early, your lungs may not be that immature. Yeah. So if your lungs are very immature, often you need a ventilator to help you breathe until you get bigger and stronger and are able to support your own breathing. So, obviously each case is different in terms of how sick that baby's lungs are or not. Some kids only need a ventilator for a couple of days, others it's weeks, others it's months. So, I think the degree of lung disease very much depends on the individual baby.
And what's a common lung disease, I suppose, that you would see in babies, and does that last forever? Or is this something that is more of a short-term piece?
Yeah, so the most common thing we see is something called respiratory distress syndrome, or RDS for short. And it's basically, you hear about surfactant. So surfactant is this amazing substance that your body makes, and it helps keep your lungs nice and open. Unfortunately, babies don't have a lot of that when they're born, if they're early. And so sometimes we actually even put in a breathing tube and give them surfactant into their lungs to try and help their lungs stay nice and open. So initially, most babies that are born preterm do have some degree of respiratory distress syndrome. Some need breathing tubes and ventilators. Others need something called CPAP, which is basically a machine that blows some pressure into the lungs and keeps the lungs nice and open. If the respiratory distress syndrome goes on for a longer time, a baby can develop something called BPD, or bronchopulmonary dysplasia. So that, that is something that, is a longer term thing, but certainly there's varying degrees of how severe or not BPD is as well.
Yeah, no, and I think these are things that, obviously children who end up with a diagnosis of cerebral palsy, or who are followed through high risk infant follow-up and things like that as well, can have these as well. Nothing is necessarily on its own. A child just doesn't have BPD or CP. They can have both, and there can be a lot of different complicating factors leading to different things. There's one more question about around birth and in the NICU, and I suppose it's something that we hear a lot about is, how do you know that your child's going to go into the NICU? What are the reasons for them doing that? You've said prematurity. Someone's also just asked the question, do babies with low Apgar scores automatically go into the NICU? And, everyone sort of hears about Apgar scores, but maybe doesn't know what they mean and how they're used in the clinical care.
Yeah, so Apgars are interesting. So Apgars, so let me start with Apgars and preterm babies. So Apgar was really designed for term babies. So we do give preterm babies Apgar scores, mostly just to give us a sense of how well, the Apgar score talks about how well the baby transitions from life in the mom to life outside the mom.
Yeah.
So the Apgar score, even in a preterm baby, gives us some idea of how well that baby transitioned. But it's not really designed for preterm babies. Sure. Now, Apgars in full-term babies, and I did mention that about, a significant number of the babies in the NICU are full-term babies. It kind of depends on what's going on. So in cases of very low Apgar scores, oftentimes it's because the baby didn't get enough oxygen during the, at some point before birth or during delivery. And sometimes if the baby's scores stay very, very low, they would also have other things. In most cases, those babies need respiratory support and other things, and they often would come to the NICU so that we can evaluate them, because we worry that they didn't get enough oxygen at birth.
Yeah. No, and I think they're really good questions that everyone's sort of sending in. So please keep asking us questions on what you want to do. But I do want to transition to home, because as you said, this moment of finally being able to take your baby home, it's such a monumental occasion. It's scary. It's like, oh my gosh, can I do this? And as you said, parents can do this. You are the center of your child's little universe, and such a wonderful moment for everybody. But what are some of the other things that you would sort of give advice for about taking your baby home?
Yeah, so I think that, and I said this already, but just to emphasize the point, I think kind of acknowledging within yourself if you're all of the conflicting feelings that go with it. You're so thrilled, but you're also a little bit terrified. And I think some people are probably more on the thrilled end, and some people are more on the terrified end, and some people are somewhere in the middle. So I think just acknowledging that and recognizing that that's normal and that's expected, and this is a big transition. I think one thing that's really important is, so the sensory system is one of the first to develop. And the sensory system is kind of it influences downstream development because it's such an early system to develop. And so one thing I think that parents can do when you go home is really do things to provide supportive sensory experiences for your baby. And things like that, if you think about the sensory system, you're thinking about things like vision. So,
Yeah.
you know, depending on the age of your baby loves your face. So, you know, talk to your baby close enough that they can see you. They want to see your face. They want to.
And that's a good point. Babies can't see far away, right? So you do
Correct.
need to come in close for them to actually even be able to recognize features.
Right. And go kind of slow. You know, they can't track very fast. I mean, again, depending on the age, but I think, you know, let them see your face. For hearing, you know, auditory, sensory, sing to them. Sing, you know, I have a lot of music therapists I work with, and they've been teaching me a lot about this, but singing songs with simple melodies, like Twinkle, Twinkle, Little Star, and these types of things. You know, vestibular. So like do skin to skin when you get home. Hopefully you've been doing that in the NICU, but keep doing kangaroo care, skin to skin at home. That's great for the baby. It's great for you.
That creates such a wonderful like mother baby bonding experience as well.
Yes.
You know, it's such a special time, and hopefully it's that moment where you all both get to have this moment of taking a breath.
Yes.
And going, oh wow, yeah, I'm at home, I'm with my baby, and just enjoying all that sort of newborn cuddles.
Yes, exactly. And then, you know, oral, depending on different babies may have different ways that they eat, or different different sensory experiences that are supportive, whether that's passy dips in milk. I mean, obviously your medical team can help you know what's safe for your baby. But these are all things that are really important to their development that you can do at home.
Yeah, no, I think that's wonderful to hear that all those things that almost come as a natural instinct to parents and to those that are caring for babies are actually doing wonderful things for their development. The other sort of question that I wanted to ask you as well is, when we're thinking about development and developmental milestones, it's really hard in a way sometimes not to compare your baby to somebody else's baby and those different things. Do babies born really premature, or those that have come out of the NICU, have different developmental milestones that you would look at, or, you know, different goals?
Yeah, it's a great question. So in general, babies that are born early, you have to account for their prematurity in terms of their milestones. So, you know, if a baby born full term tends to, you know, whatever it is, social smile at 8 weeks, you have to subtract the prematurity from that. So your baby by their birthday might be, you know, 6 months, but by their prematurity. So, you know, you in the NICU, you hear about corrected gestational age. And so you really do have to think about that. You don't compare your baby to, well, probably not any baby, but in general, don't read based on their birthday, read based on their due date, because you have to account for that. You know, we do expect them to do the same milestones, but we do account for their prematurity in terms of the timing.
I think that's so important, particularly with so many apps and different things that a lot of mothers start to use with milestones. It's like, oh, my baby's, you know, was born 4 months ago, but they're only doing something that's at the milestone of a 2-month-old. Well, that could actually completely correct for your child, particularly if they're born 2 months early.
The other piece of it is that, you know, even in full-term kids, kids do things in their own timing sometimes. And all these developmental milestones are in a range. You know, so if you have more than one child, you know, all of your kids do things at different ages. And I think the other piece of it is that, at least in my clinic, what I try to tell my parents is that if your baby is making developmental progress, I'm happy. So, you know, they can do things on their own timetable. That's perfectly fine. But I just want to see them continuing to make progress and move forward. And I think that's the goal. Not that they would necessarily, you know, go in this certain order of milestones, but that they would continue to acquire milestones in whatever timing they do.
They do. And I think that goes back to like really trusting your instincts, right? That parents know best in a lot of different ways. You know your baby better than anybody else knows your baby. And, you know, every child is different. And it doesn't mean that every parenting approach is going to work for everybody as well. And so one other question for you. So I would love to hear about some of the research that you are actually doing, because it is really wonderful. And it's like some of the cutest research that you've ever seen. you know, but can you tell us a little bit about some of the research that you're doing?
Yeah. So, you know, I actually sort of stumbled into this research, I guess. You know, I never really planned on it. And I started working in the NICU, and I started being around babies and families in the NICU. And I was so amazed by some of the families. And I knew, I couldn't prove it, but I knew that their babies were going to do well because they were so amazing. And so that kind of got me thinking. And I have been really interested in, you know, babies born early are sometimes really sick. You know, sometimes they have a lot of complications, and we're obviously doing everything we can in the NICU to try and help that. But, you know, we're doing everything we can on that. But I think one thing that is kind of more controllable than that is, you know, how do we help parents help their babies at home? And so I've actually been doing a lot of work looking at what are the different things parents can do to support their child's development, because I think that's a huge untapped resource. And it's been really fun and really exciting, and we're really finding that parents can make a really big difference in terms of their child's you know, meeting all of their potential.
Yeah. No, and I think it's just so wonderful. It's taking it away from that really medical environment, which is the NICU, and it has to be. You know, these babies need to survive, and there are so many complications that come with that. But, you know, that transition to home and going, do you know what? The care doesn't have to be centered around this medical world. There is such a wonderful moment where it starts getting centered around the family and the parents.
Yep. Exactly. And that's, I mean, even though the NICU feels like forever, it's really quite a small part of that child's ultimate life. And I think, so I think a lot of the NICU care, you know, really should center around how do we, you know, obviously do the things we have to do to help the baby, but also how do we help the parents and the family, you know, help the baby once they leave this place.
What sort of services are sort of on offer for families in relation to that? You know, are there parent support groups that you would recommend people joining, or is there sort of programs that parents can do? What's sort of the future going to look like for that?
It's a great question. And it's something that I'm really thinking a lot about. I hope that as my career goes on, I'm going to have a better answer for that. That's kind of one of my goals. There are support groups, and I do think that having people in your life who have had a baby in the NICU is really important, because I think that there are challenges that go along with that, you know, parents who never had a baby in the NICU really can't empathize with. So I do think that there are support groups, and I think they're great. There's also, I mean, different NICUs have different things. Our NICU has parent navigators. So it's, you know, parents who actually had babies in our NICU that now we employ to come talk to families, which I think is really lovely. A lot of NICUs do like parent, you know, like parent pizza nights or support groups, you know, while the baby's in the NICU. So I think there definitely are those. And I do think having those people who get it is really important. There are also, I mean, there's a number of different places have different kind of programs for parents. That's very individual depending on the place. There's also a number of really good, like, you know, positive parenting programs that are really widely disseminated. But I think some of the resources are more or less available depending on, you know, where you are. And, but there's a lot out there. And some of it depends on what you need, and what you and your child need, and what works for you.
I think that's sort of like just such an important thing to make sure that you look at those resources, because they are out there and they are available. So ask. Sometimes it feels hard to ask. You know, we get a lot of comments around PTSD after the NICU. And so I think it's so wonderful that you say connect with somebody else who has had that experience, because really no other person will understand what that's like. And when it comes to sort of PTSD, we are actually going to do a completely Instagram live about PTSD, because not only does it happen obviously around really monumental occasions like childbirth and obviously babies going into the NICU, but it's also sort of happening to a lot of people right now with sort of this uncertainty that we've got in the world. I think there's going to be some ramifications of that. So we are, just so everyone knows, we are actually going to do another Instagram live particularly focused on that issue. But I think all of these sorts of things can are good advice for people to reach out and make sure that they get help. So if you could do one key takeaway as we finish up today, what would yours be?
That's tough. I want all the parents and the providers actually on this call to know that you are the most important person in your baby's life, and you can make a difference in your baby's life. And you, just because we haven't touched on this, you also need to support yourself in order to be in a good place so that you can help your baby.
Yeah. I think that's such incredible advice. And I know a lot of the parents on here, you know, we are here to support you. So please, if you have any further questions, reach out to us. We will send them Mary Lauren's way to help get them to answer them for you. But yeah, just wanted to say a big thank you for joining us on this Friday afternoon. I hope everyone has a wonderful weekend. And we will be back with Instagram Live on Tuesday. We have a really special guest with ESPN sports announcer Jason Benetti. So for everyone, please make sure you join us because it's going to be a lot of fun.
Thanks, everybody.
Bye. Thank you.